Good morning and welcome to Exposure Box. Today we're standing outside Ealing Hospital and I'm going to talk about how Ealing is changing in terms of healthcare. An incredible number of patients are registered in Ealing. It's over 440,000, which gives you some idea of the actual size of the place. There are around 200 GPs attached to 76 GP surgeries. In July of this year, the NHS decided to collect these surgeries into what are called primary care networks. There are 8 of these in Ealing, the largest of which is 77,000 patients in Acton. Most of them are between 30 and 50,000 patients. The idea of these primary care networks is that the GP surgeries can work together to try and give you a better service. There is money available to hire pharmacists and people called social prescribed link workers in the first year, and in subsequent years there'll be the grants to hire physiotherapists, physician associates and paramedics. Whether this will help is a matter of debate. The real problem, of course, is the massive shortage of doctors, all kinds of doctors, hospital doctors, general practitioners, and the massive shortage of nurses, all kinds of nurses, whether they be GP practice nurses or district nurses. Now, one thing you can do to help is that there's a requirement for each GP surgery to have a patient participation group. Now, not all the 76 surgeries have one. Ones that do have one, it provides a useful opportunity to get the best out of your surgery. So if there isn't one at your surgery, I suggest you start one, and if there is one, I suggest you join one, and then you can work with the GPs in their difficult situation where they don't really have enough time to see everybody or treat everybody. Now let's just talk a bit about Ealing Hospital. It opened about 40 years ago. It's had a checkered history. In 2008 it was voted the worst hospital in England. In 2012 a grand scheme by NHS North West London called Shaping a Healthier Future wanted to downgrade it and get rid of its A&E. This massive cost-cutting failed exercise was cancelled in March this year, and although Ealing lost its children's A&E, it still has its adult A&E, but it has lost maternity and paediatrics. Now, for the wonderful people who have worked here over the decades to ease your pain, save your life and extend your life, we need to give thanks. One of the real problems at the moment is that NHS North West London has massive debts, massive deficits. And in fact, the Ealing Clinical Commissioning Group, which is the group in Ealing that buys all these services, is almost bankrupt. Now, unfortunately, Ealing Hospital is going to be made a victim of these cuts, and there are going to be more cuts in the hospital. And one of the cuts that will affect all of you and all the GP surgeries in Ealing is that they're going to say to GPs, they've already said to them, you are sending too many people off to hospital consultants, and you must cut down sending people to so many appointments to hospital consultants. Now, this goes against the Hippocratic Oath for all doctors, and it'd be interesting to see how that works out. But even worse, they're only allowed to recommend one referral. So, for example, if you've got mental health problems, you've got problems with your waterworks, it's either a longish wait to see a urologist or an even longer wait to see a psychologist. Okay? Now, is there any other change on the horizon? Well, the person who runs this hospital, albeit from Harrow, is leaving in the next few months, and hopefully we'll have a new executive who wants to build a brand here, because this hospital has suffered terribly over the years, where everybody thought it was closing down, difficult to hire permanent staff, huge bills for agency staff and locums, and what it needs is a new identity and new energy. Now, here comes the advertisement. A group of local activists, including me, have decided it was time to say thank you to Ealing Hospital, and on the 40th anniversary of its founding, which is the 5th November 2019, we are holding a birthday party at the local pub down the road, the Viaduct, and we're putting on a Victorian music hall with local actors and the internationally acclaimed NHS singers. At the bottom of your screen you'll see how you could book tickets. There's still a few left. So come and enjoy and celebrate the fact that Ealing Hospital's been here for 40 years and hopefully will be here for another 40 years. This was Eric Leach, this is Exposure Box. Come and see us again next week.